What is the right age?
Ideally, the egg quality would be the best in our early 20s.
Yes.
If not, at least before you turn 30. So nowadays, infertility is on the rise. That we have to accept.
What could be the most important cause of that?
It could be pollution, it could be our sedentary lifestyle, it could be the work hours, the stress at workplace.
Stress also. Now, is it safe to have sexual intercourse during
safe.
pregnancy or not?
It is safe in most situations,
Okay.
but then it is about the woman's comfort.
Hello, and in this today's episode of The Healing Monk, we have Dr. Silpahasa, a gynecologist and a great influencer with more than 6 lakh subscribers in YouTube all across the world. She has taken us through the journey of a female that goes through for pregnancy, right from the preparation of pregnancy till the delivery. After that, we also discuss about the life journey of a doctor and an influencer, and also the struggles, even the struggles of life like facing cancer, being a caretaker for a very or close relative having cancer, and facing life as it comes. Hello and welcome to my podcast, The Healing Monk. I am Dr. Sumandas, your host. Today, before I go ahead introducing my guest, I'll take you through a scene for a Telugu movie. Imagine there are few ladies who are sitting in a room completely anxious for their very precious pregnancy. There suddenly a lady doctor enters with lot of confidence and grace. When she enters, a positive vibe comes into the room, and all the ladies who were anxious, they look at her. The moment they look at her, their anxiety disappears, and there the lady doctor says, "Nenu unnanu kada tali." That means main hu na. So you don't worry. Yes, I am talking about a gynecologist who is not only a doctor. She is a friend, a mentor and a guide for more than 6 million followers of her all across the world. She is Dr. Silpahasa. Hello, ma'am.
Hello, sir.
Welcome to my podcast.
Thank you so much for inviting me, and thank you for the kind words.
You actually deserve. I have gone through your channel comments, and they're so awesome. People love you so much.
True.
And in fact, I'll just tell you, before we started this interview, I met few ladies at this place, and they were like, what is the interview about? Then I told them ki I am taking an interview with Dr. Silpahasa. The next moment, two of them are, YouTube, I follow her and we see her. So that's the followers you have, and they have been positively impacted by it. Yeah. That is most important.
True, sir. I don't know how it happened, but I feel blessed because they're not just subscribers or followers. They're emotionally connected to me.
Yes, yes.
And because I see a lot of positive comments in any video that I post. So
it's more than they like you, mainly because you are kind of honest.
True.
You are kind of honest, and whatever you say, whatever videos I have seen, even few of your interviews I have seen, you have been very honest in giving the views and opinions. Whatever is correct, whatever is wrong, and that is most appreciated, and people like it.
That is one aspect, sir. The other thing is there is no agenda.
Exactly.
If I do this topic, I'll get this many views. It was never there on my mind.
Correct.
If I see a patient suffering with something, then I would feel that the information should reach people. Another woman shouldn't suffer because little mistakes cost people so much.
Yes.
Because some people think that if they miss their period, like if they know that it is an unwanted pregnancy, and they just take a progesterone tablet. They'll go to a chemist and they take Meprate something. There'll be a little bleed and they think it's gone.
It's gone.
But the pregnancy will continue till 6th month, 7th month. Imagine that is happening to an unmarried girl.
Unmarried girl.
So, small mistake.
So-
If I tell that, at least 1 or 2 people will get
Yeah,
benefited.
out of 6 million, if one person is benefited, that your aim is achieved actually.
Yeah. People are so sweet, sir. There are many doctors who are doing content, but I had the blessing.
Yeah, it's a blessing and it's your honesty. It's the blessing comes after we are honest to ourselves. Then only the blessing actually comes.
Whatever I do, I don't do it without thinking.
Yeah.
It sometimes works.
Okay, tell me.
Even
you're-
now, we don't know what we're going to talk.
So tell me one thing. You are very confident on the on your YouTube, and even when we speak to each other, you speak very confident. Were you like that from your childhood, or how was your what was your personality during your childhood, your education time, and all?
I'm totally different now. This is like a new person. I was very underconfident. I wouldn't speak in public. I wouldn't even speak loudly in public. Even if I have to talk to my mother, I'd whisper. And if they talk loudly, I wouldn't like it back then because I was very underconfident.
Okay.
I grew up in a village with 6 of my cousins. I
Srikakulam.
studied in Telugu medium till my 10th grade. And then I shifted to my parents' place. I wasn't confident, but I feel that life changes you.
Yes.
We
Situation
keep
changes.
Yeah, we keep changing. For example, I didn't know how to ride a bicycle. Okay, and I entered into KGH, medical college. I was traveling in share auto from my dad's place to KGH. One day I was traveling in the share auto, and the watchman of the neighboring building, he sat next to me. I thought, okay, this is not going to work like this. So it's not like I couldn't afford a separate transport, but what is there environment friendly? We should use public
Okay.
transport is what my motto was. Then I thought, okay, it's not going to work. So what did I do? I started to learn to ride a bike.
Bike.
So I used it. And then I had to shift to Madhurwada because my father started to build a place here, home. So then I couldn't travel from Madhurwada to city by bike.
By bike.
I had to learn to drive a car because calling the cab driver and giving him directions was such a pain every day morning. It is a waste of time. I have to have my time. So it was a necessity to learn to ride a car. So
Invention
I feel
is the
that
mother of necessity is the mother of
necessity is the
invention.
mother of invention, and we keep changing according to situations. And I would say and even in MBBS, I've never spoken to a guy. I've never spoken to a guy. I don't know my seniors I don't know who my juniors were.
But now everyone must be knowing you.
And even they appreciate it, and even they are surprised when they see me in YouTube.
Okay.
We never expected you do this. But I would say the most important role a person has played in this transition of my life is my husband,
Yeah, Durga.
Durga Shekhar. Absolutely. Because my father and mother, they love me and all, but they never made me feel confident of my skills.
Again, it is a generation
Absolutely,
that
sure. Maybe that is the reason. But I never thought I was beautiful enough. I never thought I was tall enough, or fair enough, or smart enough. I was not at all confident. After meeting Shekhar, he changed my perspective about myself.
But he's such a calm personality. I have met him so many times. He's such a calm personality. Who is like he absorbs everything, and still he is calm and like
Doesn't
that.
express.
Yes,
Just
yes,
takes it all in. So he changed me, I would say. I would always wear high heels when I was studying MBBS. I used to think that I'm short. I would always wear
okay.
high heels.
You would have
No, I
that in your
don't.
back of mind that I have to I have to project myself, kind of.
Yeah, I don't know. I felt short. Maybe this is not the ideal height for a woman
Girl.
to feel beautiful. That was there in my mind.
Mm-hmm.
After I got, he's 5'11". After I got married to him, I should be wearing even higher heels. No, I stopped wearing because I am happy with myself. I'm happy with how I am. That kind of acceptance I got from him. So I think he changed me in many ways.
Yeah, definitely. People around us actually they help us to grow, and especially spouse, they play a big role in that.
And
And
you said, sir, honesty and all.
yes, yes,
That honesty I got from my family.
yes,
My father and mother. They're
yes.
very kind. They're very honest.
I have spoken to your father few times, and I have seen that. In fact, he will always be contacting me for some of his friends, relatives, or someone's report that Doctor Garu, this is there.
True, sir. Because
He was in
after,
police or something.
yeah, he's a retired deputy superintendent of police, and he's now practicing law.
Okay. I have seen his uniform photo.
He loves his profession.
Yeah. Prasad Rao garu, right?
Sadhra garu. It's a blessing to have been born in such a wonderful family. They're very selfless. After I got married, my mother didn't leave me even for a few months. Like after I joined MBBS, my father was still working then. He would move. He'd get frequent transfers. He had gone to Rajahmundry and then Anakapalli and Tirupati. Wherever he would go, she wouldn't leave me. She was there throughout.
Throughout the.
Throughout. Since I got into MBBS till today, she's there.
So during your MBBS time, and did you ever think that you are going to join gynecology, or?
Never. In fact, I hated gynae.
Acha.
I absolutely hated gynae. I'll also tell you the reason. There used to be a PG, postgraduate student, who would hate the branch so much that when I see her, I started to hate it too. While examining the patient also, she would wince and she'd say, give such expressions and then do the things. I was like, I was not much into gynae, but I knew that I was interested in surgical branch. But when I had to choose a postgraduate specialty, Shekhar had already joined anesthesiology the year before.
Yeah.
So I thought if I take gynae, my surgical skills
Will anyway be.
I'll be able to fulfill that, and it'll be complementary to his branch. That is the reason I entered gynae.
I
I
never
also
wanted.
had another this thing, sir. Whatever we do, whatever specialty that we take, if we do it well, if we excel in it,
Exactly.
we will get success.
I'll tell you very nice incident. Recently, one of my patient's son is a engineer, and daughter-in-law is a doctor. Recently, the daughter-in-law is preparing for MD, and so the son says, "Sir, I am telling her to take anesthesia, and but she doesn't want. She wants to take gynec." Then I told him one thing, that remember, she can divorce you, but she can't leave her subject. So that subject that we take remains in our entire life. So let her take whatever subject she loves to. Otherwise, your life will not be happy. And
Because we cannot change it.
yes,
How happy we are at workplace will also reflect in our
reflect
personal
in
life.
our family.
But now I am glad that I made that choice.
Yes. Actually, it is immaterial what subject we choose. We have to be like honest. We have to be committed. We have to see the patients like as we are in their place. So that is what we have to see. Then only we can give a better care and service to them. So that's the thing. When you consult your patients, do you see yourself in them, like personality wise? Sometimes you see this person is something like me when I was.
No, sir, very rarely. Very rarely I would relate to the patients that are there today. Because everybody is so anxious and so scared. Before going to TIFA scan, they would think that something is going to be wrong.
Yes.
Why? When they get the TIFA scan, they feel so relieved. Matlab, they were anxious before. Why should they be? Why can't they treat
Yeah.
pregnancy as a normal condition?
Normal condition.
I was working till my water broke. I was going up and down the stairs. I was assisting surgeries. I was doing night duties. I was doing everything. But nowadays, people are pampered so much. They ask me, can I eat coconut? Can I eat carrot? Because it'll be hard. I don't relate to the patients at all when they ask such questions.
Yes, yes.
Pregnancy has to be normalized. I
It
don't
has
know
to be
why
normalized.
so much of anxiety
They
or
don't
pampering is
they
there
don't
around
walk,
pregnancy.
they don't do any work.
No,
They
they have
take
to take
leave from
rest.
the
They'll ask me, there are 10 steps in my house, can I climb them? Why can't you? Not just pregnant ladies, so people who are planning pregnancy also ask me
yes.
that. I am surprised at how people are thinking nowadays. It's not like whoever is planning pregnancy, they'll absolutely take bed rest. No, no, pregnancy is a normal condition. We should start to normalize it.
So in order to plan pregnancy, suppose the people are planning pregnancy, like what are the specific things they should think about? Like let us say their health condition, exercise, or food. What are the specific things you would suggest?
So nowadays, infertility is on the rise. That we have to accept.
What could be the most important cause of
It
that?
could be pollution, it could be our sedentary lifestyle, it could be the work hours, the stress at workplace,
Stress also.
or the failing to have a daily routine, or too much socializing over the weekends, multiple things. So I wouldn't force them to get pregnant when they're not ready, but they should consider the fact that the clock is ticking. They should plan pregnancy at the right age.
The right age.
And then they have to make sure they're healthy.
What is the right age?
Ideally, the egg quality would be the best in our early 20s.
Yes.
If not, at least before you turn 30, that would be the right
So
age.
like 24 to 26
That would be the best. That would,
would
be,
be the
good.
best
That
time.
would be good. And make sure you're healthy. Get your hemoglobin done. Check your thyroid levels. Make sure you're not a diabetic. Many people, when I as a routine write a HbA1c, their levels will be 9 and 10. You won't believe it. They don't know that they're diabetic. So run some basic tests. Maintain ideal weight. And have a good exercise routine. Eat healthy. All these are important.
People actually they try to do exercise, lose weight before they marry. After they marry, they just get very relaxed.
It happened to me also, so I can't deny.
Marriage हो गया अभी और क्या है?
They feel relaxed. There's a difference. The lady gains weight post marriage more than the guy.
Husband. Yeah.
Because they feel that they have to fit in they have to look a certain way on the wedding day, or they have to fit into certain clothes. They give importance to the looks. So that's probably why. After getting married, they feel relaxed and go out and eat, so they gain weight.
And even the amount of pressure they get in the home household works also, they feel that I don't have time for any exercise and all that also adds a bit of it.
That problem is there with every woman, not just a newly married woman.
Yes.
But that scenario has to change.
That has to change.
A lady, she should take time for herself.
Yes, yes.
Even my mother does the same mistake. Even when it comes to eating also, they don't eat on time. They think that everybody in the family should eat and then I will eat. I would say, you have been working since morning. You are the one who should eat first. And I would always say this, and that is also a reason for starting this YouTube channel. When a woman is healthy, the entire family will be healthy.
Yes.
And when a woman is educated, the society will be even better. She will
take care of everything. She will take care of the entire family in the right way. If they are not educated, they will not even feel the importance of education for their children. And see how much mark they are getting, what they are studying or not. If the woman is not educated, they will not.
The character development.
Yes.
An educated woman, a smart mother, they play a major role. But women should start giving priority to themselves. Even when I come back from hospital, I'd be hungry and I'd start eating. My mother would say, how can you eat before feeding Arya? I said, I'm hungry, she's not. I'll eat first.
You have to give time to yourself. You have to give respect to your own body.
Even I tell Arya the same thing. I'm the most important person for myself in this world. You come after me. I am that kind of mother, so I don't know. Some people may agree, some people may not.
It is immaterial actually.
Yeah,
it is
how
not
one should feel. We have to be important for ourselves.
So, like let us say someone they come in their first trimester of pregnancy. So, what are the common problems or complaints that you face, and what are your common advices that you give them?
Usually in the first trimester, they won't feel like eating, they'll be nauseous. That is the most common thing. But some people will suffer from hyperemesis gravidarum. It's a little more, I mean, excessive nausea than usual. That is what they suffer most. Or a slight headache, or lack of appetite, or unable to sleep. These are some small challenges.
Small
But
challenges.
then I would say every trimester is different. It's
Yes.
not like first trimester, second trimester, third trimester.
Trimester.
Each trimester will have its own set of small difficulties.
Small difficulties.
You shouldn't give too much importance to that, because the last visit, before coming here, I've seen a patient. 2 weeks ago, she came to me and she conceived with my treatment in second month. And her mother was crying for 5 minutes and hugging me. She was crying and everything fine. Today she came and she was sad face. There's a lot of vomiting sensation. I can't eat anything. 2 weeks ago, you were related. Today you are behaving like this. Pregnancy comes with a little bit of difficulties. We have to face it.
Nothing comes free of cost.
Yeah, you shouldn't. You should try to.
Yeah, in
handle
fact,
it.
many people, they stop going to work, stop going to walking and all that, and they more. It is a mental situation basically, and they kind of overthink about that symptom. So that symptom comes more. That nausea and all.
And yeah, they'll take rest. I always tell my patients, stay active, be physically active, be mentally active. Even if you are advised to have bed rest, do something with your mind.
Yes, yes.
Read something, learn something.
Even bed rest doesn't mean that you have to lie on the bed. You
Yeah.
can just walk and
We
sit
notice
also.
it ourselves, na, sir. Whenever we're free, we find some aches here, aches there. We are busy, we won't have time to think about all
Yes,
that.
yes.
I always tell my patients to do a kick count, count your movements and all. I never done it. I've never done it when I was pregnant. I didn't have time to do it.
Exactly.
I was working all day.
Even when my wife was pregnant also, I insisted her to work almost till 7th or 8th month. So that mainly, and she is a person who gives so much time to her work, so much commitment to her work, that she will forget about any symptoms.
True.
She will forget about, and that happens to everyone. So everyone should, in their first and second trimester especially, I think, they should continue their work. And they should, in fact, my own receptionist, she is pregnant. She is going to get delivered on this Saturday. And she was working till yesterday.
Yes, that's the right way to do it.
So that's very, very important. So you must be encountering a lot of myths of the parents or the patients during this after conceiving. What is the most what you call something like interesting? You felt, what is this kind of that you had to debunk their myth?
It's not interesting. I sometimes get annoyed when they ask such questions. If I ask them to eat egg, they say that if she eats egg, the baby will be bald.
Acha.
The newborn will be bald. If she takes iron supplements, the baby will be black.
Black. Okay.
So they've decided that.
Someone must have told in the village or
That's the
something.
problem, sir. See, I don't worry about those things. Okay, I tell them, no, it doesn't happen like that. It's decided by your genetics and all. That is tolerable to a certain extent as doctors. There is another incident I'll tell you. About 4 weeks ago, a lady, she's physically handicapped. She fell down from a second floor when she was working somewhere, and her hip and femur were broken. She has a little limp. Now she's pregnant. She came to me with tears in her eyes. She's crying like anything, like a small kid. I've always seen her smiling and happy every time. She's crying. I asked what happened. Madam, everybody is saying, why should I conceive? How the baby will be? The baby will be defective like me. What is the reason for you to get pregnant? Is that a way to talk to a pregnant woman? Ek to we are talking about over pampering. That is bad, and this is horrible. You cannot do that to a pregnant lady. You cannot do that to anybody. Anybody.
I face that day in, day out. Patients who suffer from pregnancy. I'll tell you one incident. Like one of my sister had I think a huge fibroid.
Okay.
So she had a huge fibroid. So she was scheduled for surgery. So few days before surgery, her friend calls her and tells, "Hey, we are very stressed. Why? Now, if your that thing comes out as cancer, what will happen? I told, why the hell they are worried about this? And this is height of negativity. You can't tell someone like this.
People are consuming knowledge, like people are consuming information too much. And with their acumen, with their IQ, with their knowledge, they are looking at it the wrong way.
It is like deciding about the entire news by just reading the first one line of the headings, basically.
That line also they'll understand according to their knowledge.
Their
That's
knowledge.
what is the problem.
And in the present day, because of the social media, we are kind of flooded with this.
Informations are true.
So we have to judge the people, and mostly I always tell my patients that don't listen to anyone. No one has any knowledge to tell you anything about cancer. If you have any doubt about cancer, you come and ask me, rather than asking so and so. And people will give some or the other information. It can be most weirdest of the opinions, but they will give something.
That's the free advice, sir. People should stop giving free advice.
Exactly.
They mislead people.
They mislead.
Sometimes people, a lady with white discharge, she comes sobbing and crying to the OPD. When I ask her what happened, my neighbors told me it could be cancer. A lady with little black colored menstrual flow, she'd also come crying. She'll say that somebody told me it could be cancer. So you can't spread false information.
That is one thing is information, and another thing is how this person also takes. It is our again human mentality that suppose someone gives us a information, we will extract the most negative part of it and we will remove the positive part of it.
We'll take what is
yes.
convenient for
What
you,
is convenient for us, and we will react to that. Because that enters into our mind. Maybe the neighbor who would have told, he would have or she would have like heard it somewhere that it could be. It's like we see a lump, we tell that it could be a cancerous, it could be non-cancerous. But the same thing if the person takes, okay, I got cancer, and entire family start crying. That is what actually happens. That we as families also, they take up that negative information more.
Okay.
And they will try to escalate, and they will kind of speculate, and they will try to think a lot of things, and take opinions, and that is what is most problematic.
Overthinking is the biggest disease.
Disease.
These days, that is the biggest disease.
So this during like pregnancy, I commonly see like ladies, they go to their home to be with their mothers, telling that the girl can be more safe or confident or whatever they can express to their mother. What do you think? Is it the spouse, being with the spouse during that time is more comforting for the female, or is it away from the spouse? Let us forget about being with parents or not. Is it how do you consider? You must be seeing your patients in their pregnancy, early pregnancy, and then mid and last, coming without their spouse and with their spouse, and their mentality, and how do you? I think no one would have asked this question to you, and
the ladies who come with the spouse, and they're very comfortable and they're very happy with their pregnancy journey. But then it also depends on the kind of spouse.
Exactly, that is another thing.
It's about the comfort level. If your spouse keeps tantrums and he asks you to cook and he'd irritate you, what's the use of being with that spouse? These things happen. Sometimes I hear that the spouse forces her to have sexual intercourse during pregnancy also. Now tell me, is it better to be with that spouse or
is it safe to have sexual intercourse during pregnancy or not?
It is safe in most situations, but then it is about the woman's comfort.
Woman's comfort.
But people do not.
They cannot force.
People do not realize that they complain. Sometimes the man complains. That is okay and acceptable to a certain extent. Sometimes the mother-in-law comes and asks, they're not having sex. Is it a problem? You tell them to have. Why should they have? Why should you tell or why should I tell?
It is their comfort level.
India, the in-laws, they enter into that private space of couples also. That is not right.
Correct.
So it's about the lady's comfort level. And one more thing is the reason for most women going to their parents' place is that the parents are supposed to pay for their first delivery. Do
That
you know
should not
that?
be. Oh my God.
I came to know that when I was doing my post graduation.
Acha.
That is the reason. A man wants his surname. The in-laws want a male hair, everything, but they don't want to pay the
Now
hospital
also,
expense.
so you see this male, female?
Now also, a lot of it, sir.
Oh.
Not less. The husband will come for checkups, everything. He'll be there. He'd take the baby first and everything. When the front desk people ask him to pay the bill, my father-in-law will come and pay.
Oh my God.
Isn't it silly?
That's actually silly.
Yeah, we should change.
Yeah, we should
We stopped
change.
wearing dhotis and everything. No? Why are we still stuck in that mindset?
And they should do, what is that they should? There is no rule as such. No, nowadays, do you, in this present era, do you see that male and female discrimination also?
A lot.
Huh?
A lot. People who near the end of the pregnancy, sometimes they get very anxious and they get irritated for no reason. They cry in the visits for no reason because they have that family pressure.
Oh.
Especially if they
When they
already
need a
had a
son
girl
and-
child
uh-huh.
and if they're pregnant for the second time, they feel so much pressure. I saw it many times
Many times.
before.
I had one.
Recently, so I'll tell you, one lady, I delivered her first baby, that's a baby girl, cute baby girl, and this is the second pregnancy. She had no risk factors at all. On table, when Shekhar was about to give anesthesia, her heart rate went up to 160.
Acha.
160. Her mother-in-law was giving me pressure in the OPD whenever she would come for consultation. This time it has to be a boy. This time it has to be a boy. She would warn me. Imagine the poor daughter-in-law, what she must be going through
Oh my
every
God.
day at home. Her BP shot up. So
She
that
must be anxious what it is exactly.
So
And,
that is the pressure that Indian women go through sometimes.
I'll tell you, this is a heart-wrenching story kind of. In fact, I have also written it in my blog. Once what happened was I got a call from a friend, someone known to him had it was a leukemia. The lady got leukemia, not properly evaluated. Now she is in the last trimester of her pregnancy, maybe I think so 27, 28 weeks. And then she has presented to the casualty with platelet count of I think so 15, 20,000, something like that. And that time I thought like we'll send her to Hyderabad or something, but the condition was as such, it was a Saturday night and was as such that if I'll send her, she's going to die. Then I contacted Dr. Bhulakshmi, was the gynecologist there, and I contacted her and then I told madam what to do. We can't send her, we need to deliver the baby. Then we did we gave platelet STPs and all that. We improved the platelet, and then we waited for a few days, and then got everything ready with preterm birth and all, and we did the delivery also. Then after that, the mother in fact died of bleeding, internal bleeding. With the platelet was low, and we could not revive. The worst part was the next day the baby was a girl child. So the sister who had brought the patient to me, the next day I think 1 or 2 days after that I called ki what happened to the baby and how is she, like that. I just called out of my curiosity. And then they said that, sir, it was a baby girl, na? The boys, when the husband's family, they didn't take her, and the girl's family took her, and I have no idea about it. I was so sad that day that this happens even now. Even now also this happens.
It happens.
And such a situation where the husband, how can they live with such thought process? Further, they will go and marry someone else. Again, they will expect a boy.
People have started to change, I would say.
Yeah,
Nowadays, more
education
people are
has changed.
appreciating the birth of girl child. But
But still it
our society
persists.
has to change.
Yeah, still it persists.
Miles to go.
Miles to go. I've seen your videos, like you love the children, they're what you call the newborn babies, and you love their expressions and all. You capture them very nicely also. Tell me something like the one of the best episodes which you would like to remember of like giving birth to someone, some nice episode that you would always remember in your life.
I'd say every pregnancy is different,
Precious.
sir.
Yeah.
Every baby I delivered gives me immense joy.
Yeah.
Because it's just a baby, it's just a patient for me, but for the patient or for the lady,
It's
it
precious.
only happens once or twice.
Yeah.
So I think every pregnancy is precious. If I deliver a poor woman's child or if I deliver a rich person's child, its joy is the same. I
Yeah.
deliver a male baby, the female baby, the joy is the same. I do a normal delivery or a cesarean delivery, the joy is the same. It's the same. It's not like something is special or something is not special. Also, people will see that smile at the end of the delivery or cesarean, whatever, but they don't know, you don't know how much drama goes behind that.
Yes.
How much stress we all face or how much pain the lady suffers. We don't know all that. But when the outcome is good, all is well that ends well.
So once when my wife was in her during her labor pain, one thing I had read somewhere that you, in order to divert your attention, you do something that you like or tell the name of the god, something like that. And somehow we believe a lot on Sai Baba. So then I told her, okay, just you focus on telling the name of Sai Baba, like Sai Ram, Sai Ram, Sai Ram, and just focus on that, forget about the pain. And she did that. She was having pain, but she was kind of controlling that. The room adjacent to us, the lady, the kind of screaming, and she was screaming the entire right from evening 6 o'clock till the next morning. Okay, and we people were kind of, she was having pain, but one thing I had always told her, ki, see, you have to conserve your energy for the last push.
Absolutely. Very, very true.
Okay, so you have to conserve your energy for the last push. So for that reason, you would have no option to even cry and shout. So you have to conserve your, if you shout now, in the end you will not have your energy left to push the baby out. That time you will need a huge amount of energy. And she was doing that. And in the end, when like in the labor room, that lady was still crying, she was not able to push, and my wife went and immediately the baby came out, and just the delivery happened within hardly 3 to 4 minutes.
Okay.
And that lady was still crying till that
The
time.
pain threshold also, it varies from person to person.
Person to person.
It also depends majorly on the
Willpower.
and how we train ourselves during our pregnancy period. We have to be prepared for the big day. That the parents and in-laws, they have to teach that it is going to be
Yeah, we
there.
used to talk
Try
to each other.
tolerate for one day.
We used to talk to each other. See, we'll have normal delivery until and unless it is that kind of episode that complication is there, that baby is not coming out, then only we'll go for cesarean. How frequently nowadays you see that the parents or the child says that I can't bear pain, I want to go for cesarean section?
Many times. Nowadays, the situation has changed so much that normal deliveries are happening only when we are giving epidural or when the woman is coming in active labor.
Okay.
Epidural, they're able to, of course, they'll be comfortable and they're cooperating. Otherwise, 90% of women, they're not tolerating. More than the woman starts to say, I can't tolerate. The mother starts to cry. My daughter is very sensitive. She cannot tolerate pain. You please do cesarean. People are thinking that gynecologists are doing a lot of cesareans. But people are putting muhurtams.
Yeah, muhurtams.
And they do not want to have slightest pain. They do not want to have zero. They want to have zero risk to the baby. Normal delivery is associated with certain risks.
But even cesarean will also have its risk,
In
right?
terms of baby. For in your fetus, normal delivery, when the baby passed through the birth canal, sometimes it goes through stress.
Yeah.
That can result in fetal distress.
Yes.
So that slightest chance we should take.
Yeah.
Today I induced two ladies. They may deliver normally or I may have to do a cesarean section. That chance also they don't want to take. They want 100% surety for everything. There is no 100% surety. So people have become very sensitive.
Very sensitive.
Instead of
and,
supporting and giving moral support to the women in labor, they are pulling them back.
yeah. Earlier days when I was working in a PHC, there was a lady who came to the OPD walking like this. Okay. And I just completed my MBBS at that time, and then I was asking my sister that hey, she's in her, I think she was in 33 weeks or something like that, and she's walking like this. She's coming, doctor, when it will happen? I am not like that. But she's very cool and she's walking alone, and then she told, sir, in village these are all okay. They are completely confident, and if it happens also, I am going to do it at their home also, not a problem.
But they should stay active. They should go up and down the stairs. They should go for walks. They should do exercises. They should eat in moderation. They gain so much weight. Excessive weight gain also one should avoid.
Yes.
The parents pamper them with a lot of food options and
They should
everything.
not.
They should not.
What are the best food advice that you would give during pregnancy?
It has to be a balanced meal. Like how it's needed for you and me, it has to be a balanced
During
meal for
pregnancy
the
also.
lady also. It should also have good fats that helps with baby's brain development and all. And it should have good amount of protein. I would say Indian food is lacking in protein. Protein should be there in each meal. They have to make conscious effort to include protein in their diet. And a good amount of carbohydrates and vegetables. Better avoid street food and avoid giving into pregnancy cravings. Once in a while is okay. Every day you can't have a craving and end up ordering out or
Anyone
eating out.
ever has asked you for a cheat to crave for her craving?
Mostly they would ask for pani puri, noodles, these things. Then I tell them, let her, in the first trimester I usually say this, let her eat whatever she feels like eating. Do not force her in first trimester because they would have a lot of food aversions and all. Then the next visit, the lady was asking me, the mother-in-law or mother, she was asking me, madam, you said she can eat whatever she wants. Every day she's eating pani puri and noodles. I said, eat whatever you want, but it's home. It has to be home cooked meal, not outside food.
Has someone ever told you that you told her to eat? That is why my daughter is getting fat.
No, they didn't say that. But when I made a video on this topic, the people have written. Then they will every day ask for bhajis, pani puris and all. So they were writing in the comment section. Eat whatever you want doesn't mean junk food or outside food.
Correct.